So we're going to go coast to coast now, and joining us are infectious disease specialist Dr. Lisa Barrett from Halifax and Dr. Srinivas Murthy here in Vancouver. Dr. Barrett, let me start with you. The Atlantic bubble has largely been regarded as a success story in keeping case numbers low, but are there other factors playing into those low case counts on the East Coast?
Absolutely. To remind people, the Atlantic bubble includes that when you travel from outside our 4 provinces, that you do daily electronic check-ins and that you quarantine or isolate for 14 days. It has helped us to have low case numbers, but there's a couple of other things I don't think we should forget. Number one, we did wait until our case number was very, very low to 0 for 2 incubation periods before we rolled back precautions. Number two, we are keeping things fairly tight, and people are good at doing that within our own borders. And then number three, there's also the fact that with the exception of PEI, which has a fairly high population density, believe it or not, we do have a fairly low population density and the ability to space out a little bit. But a lot of credit goes to Atlantic Canadians who've been doing a great job.
We can talk about population density at a different time because I'm trying to picture PEI and high density, but we'll leave that aside. I'll take your word for it. And let's move across now to the west coast of the country. Dr. Murthy, as I mentioned, Dr. Bonnie Henry, the public health officer here, would like to see numbers lower, but she points out our curve has essentially been flat here for a few weeks now. What's your assessment of how BC is doing?
Yeah, after that spike in late August, we've been able to maintain a reasonably flat curve in terms of cases, hospitalizations, and ICU admissions. So I'm cautiously optimistic that we can maintain this and hopefully push that downwards. We've instituted some policies to limit those spreading events. Things like nightclubs and banquet halls have been closed since late summer. And so hopefully with those policies in place, we're able to continue to flatten and hopefully bring downwards over the coming months.
If we look across the country, daily case rates are virtually 0 in Atlantic Canada, except for New Brunswick, which, as we've mentioned, is dealing now with outbreaks. In the West, case rates are more significant, and the highest numbers of all are coming out of Ontario and Quebec. So per capita, Alberta, Manitoba, Ontario, actually kind of similar. New Brunswick's rate getting close to what we're seeing in BC, in Saskatchewan, and Quebec's rate looks the worst. And we know within each province there are variations by city and even by neighborhood. But Dr. Murthy, I want to focus on Quebec and Ontario. From your perspective, why are we seeing those hot spots there?
I think there's many reasons why those are hot spots right now. I think first, they always had some smoldering cases and opened up reasonably early on in the summer. And so a likelihood of it resurging was inevitable. Number two, I think the testing situation. I think that lots of people have had that conversation about the testing challenges they've had in Ontario and Quebec, and having a robust test turnaround time infrastructure in place would be great for them to turn things around. And then lastly, I think they took a while, I guess, to start closing things down when this case count started to surge over the past few weeks, and hopefully things will start to flatten going forward.
And Dr. Barrett, let's finish with this, and I know it's a broad question, but if health officials were to come to you looking for advice, what would you tell them?
I think we need to remember that this is a big country, and this virus, to Dr. Murthy's point, it spreads quickly. So everything we need to do needs to happen quickly, but appropriately for different areas. So number one, I tell them, make sure you look at the area and what the cases and the COVID situation is like there in order to help people make a plan. Number two, keep the resources with public health in order to do rapid testing and tracing, and clearly that needs to get a heck of a lot better almost everywhere in our province. And then number three, provide people with the support they need in order to continue adhering to these precautions that we need to take, make it different for each region, make it appropriate, and make it sufficient to keep people at home when they need to stay home and go out safely when they can go out.
Well, really nice to get your perspectives from the two coasts. Thank you very much for joining us tonight.
Thank you.